Ambulance service, patient breathing.
We're back on the front line, following Scotland's paramedics.
Suspecting an opiate overdose.
For a gentleman said he's got a bomb.
There's a RTC bus versus car.
What do you mean by his arm's gone? I need to get these details, OK?
Every day, they save lives.
There's the boot off, all right?
Just had a fit for quite a few minutes.
Hello?
Oh, my God.
We need to be away from that.
But every day, they face new challenges.
When we go into people's homes, they are at their most vulnerable.
I just don't want to be here.
These things are hard to hear, and we hear them on a daily basis.
Just keep pushing, you're doing really well. We are given the instructions to help save their life. 1, 2, 3, 4.
Working remotely comes with challenges. So if it's a DV the day.
Met some great patients, get some great stories.
That's okay.
It's a great job.
Slow, deep breaths, OK?
It's opened my eyes to life.
This is Scotland's ambulance service, serving more than 5 million people in every corner of the country. This time, we're with crews in Perth, Campbelltown and Newbridge. Eight miles west of Edinburgh, SORT team leader Lee and paramedic Luke are leaving their base.
You've tasked us on 275 to start heading. Who else is going to this over?
Members of the Special Operations Response Team are called to the ambulance service's most challenging emergencies. Today, they're on their way to Olivia, a 28-year-old woman who has fallen from a horse.
Horse in the middle of the field.
You're really just wanting to get there kind of quick and get her seen to.
Jobs involving horses can turn out to be quite serious. A person can get thrown off, fractured ankles, you could end up fracturing your spine, you could end up paralysed. So the potential's there for really quite serious injury.
Thinking about the temperature as well. If she's wet, she could get hypothermic.
It's about 10 degrees now, then when you add the wet into that, innit?
It's not good for her.
It's not a good situation.
Olivia is in a field outside Dunbar, over 40 miles away.
Go ahead, Teresa.
Who else is going to this over?
I've got a church thing crew heading up. That's the nearest that I have. So they've got a 38 and an 88 moment. Mark has said pop it through to 275 and he would update of any further resources over.
The worry for us is if the patient's got multiple injuries. Given that the patient was out in a field, speed was of the essence and time was of the essence, so we really wanted to try and get somebody else that was maybe closer. In situations like that, we can call on partner agencies to come and help us.
What about the mountain rescue for down there? Is it maybe worth a shout contacting them as well over? Just given the running time, it is some distance away.
Yeah, definitely. I'll get on the phone to the police just now and I'll update.
Sure, that's all received. Thanks for that.
I asked for the mountain rescue to attend. We had asked for the Coast Guard. Helimed had been dispatched as well. So between us all, somebody could probably get there, you know, pretty quick and start the treatment of the patient.
After a 40-minute drive,
so we're not far away.
The team approached the scene.
It's a narrow wee road, a narrow track.
But before they can reach Olivia, they have to carefully cross a field.
Oh, down here? Right, we'll get down here, Lee.
I'll move out of the way if you maybe come from this angle. It is quite a bumpy bit to get into it, but then it is a track.
Oh, aye. It's just it's a bit overgrown there, isn't it?
Aye.
Is this the off-road one?
These are all four-wheel drive.
The track goes right around the perimeter of the field.
Right, thank you very much for that. Cheers. Here's your postcard. So, there's a lady says that this is the best road to it. Right. But just follow that track, aye.
No worries.
No worries, you step out.
Are we getting there, lass?
Right, take it easy.
About 5 minutes.
Some of the grass that we were going through was really long, and so you didn't really know what was underneath it or what was at the other side of it.
Oh dear, 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 dear.
I was a bit apprehensive, trying to keep an eye on the angles and our tilts to make sure we weren't going to tip.
275 on scene.
Olivia is already receiving treatment from a local ambulance crew.
She's come off a horse, she's landed on her feet. And she felt a crack when she landed.
The paramedics suspect that she has broken her ankle. They are giving her Entonox, more commonly known as gas and air, to help with the pain.
Right, so she's got a 10 out of 10 pace.
So we're just getting some morphine on board now, and then we'll get a look at that.
Right.
With the Entonox having little effect, the team need to consider stronger pain relief.
We've got Penthrox as well. See that Penthrox, no?
So this drug, it's a similar idea as Entonox. It's just, it doesn't take as much effort to get it, and it seems to work just a wee bit quicker and sometimes can be a bit more efficient.
It's really important to give pain relief before you assess the injury, because if you don't, when you try and touch the patient's injured limb, they will be screaming in agony.
See if you get a good breath in it, the taste goes away a bit quicker.
The team will wait for Olivia's pain relief to take effect before assessing the seriousness of her injury.
These sort of injuries can be limb-threatening, especially if the blood supply is occluded and it's not getting to the injured limb.
Just keep puffing away on that.
Okay.
Mode activated.
Paramedic Kira and technician Ashley have been diverted to a call in Perth city centre.
So male under the influence, overdose of street Valium, naloxone not administered.
A man has been found unconscious in a car park. It's been designated a red call.
That's one of our highest priority calls, so we're expecting this patient to be very, very unwell. So your heart does race a little bit faster.
And the biggest thing we sort of look out for is the patient's breathing. Are they respiratory depressed? Is their breathing slowing down? Are their oxygen levels low? And that's probably the biggest risk with taking drugs like Valium and opiates.
We are hoping that potentially the call's been graded higher than it needs to be. Always you're thinking maybe it's not going to be as serious as when you get there. In this instance it was. Hi there. Who do we have here? Did you guys know him?
Yeah.
Is he breathing? They're breathing. Good, good. A drug overdose is not a simple job. There's so many different factors into why it's happened, what's caused it, what drugs they've taken.
Do you know how much he's had?
So no, street Valium.
Street Valium, yeah. Okay. Do you know how much he may have taken?
No.
No.
Fortunately for this patient, he was discovered by a local community worker who knows the details of his drug use.
With taking these street Valiums, we don't know what it's been mixed with. And is that all that he's taken?
Does he normally take anything else?
Yeah, he's on the jag, he's on the Buvidal jag.
Buvidal is a medicine used to treat dependency to opioids like heroin.
So especially with opiates, it slows your breathing down, it drops your oxygen levels, your breathing rate just becomes so slow that eventually it will stop, and then these patients will die. Are you happy we're going to give some naloxone?
Yep.
I'm just going to draw it up.
With the patient unconscious, Kira administers naloxone, which should reverse the effects of an opioid overdose.
Naloxone is a drug that we carry, and it's actually provided to a lot of sort of first responders, people who work in drug and alcohol, and we give it to opioid overdoses. So we give it to your heroin overdoses. morphine overdoses, even if someone's unconscious and we're not exactly sure what they've taken. Okay, so that's given at, we'll just double check the time.
Naloxone is usually a fast-acting drug, but this time it seems to be having no effect.
Might just pop him on some O2 anyway, just because he's not responding.
Ashley and Kira assessed the patient's consciousness using the Glasgow Coma Scale. The test includes causing pain.
He's wincing, but he's actually not as it was before, and that's quite a strong pain stimuli.
When we assess a patient, we'll quite often do a painful stimuli, and it might look a bit brutal from the outside, but we do this to check their brain's still functioning. In his case, there was nothing. He was in our scoring, he was GCS 3, which is the worst that it could be.
He thinks his stats are just dropping off now.
After a few minutes, Kira decides to administer another shot of naloxone.
So I'm just drawing up a second lot. We can give it every 3 to 5 minutes for someone who's suffering respiratory depression due to a narcotic drug overdose. Nathan, it's just going to be another sharp scratch in your arm. I'm just a little bit more concerned about it now because I can hear him starting to gurgle a bit. So we just put this device in which holds his tongue out the way.
So when we hear sort of a gurgling kind of noise, it may indicate that there is sort of a compromised airway there. We'll try to ensure that airway stays open so that when we are administering oxygen, it is going in.
1, 2, 3.
The patient's airway is now secure, but with no change in his condition, it is vital the team get him to hospital as quickly as possible.
It is worrying when we get to that point. They'll become hypoxic, their brain's not getting enough oxygen, and then they will stop breathing, and subsequently their heart will stop after that. So there is a high risk of death from taking drugs like these.
You're warm enough in that, yeah, good.
SORT team members Lee and Luke are with 28-year-old Olivia, who has fallen from a horse and suffered a serious ankle injury.
How's your pain now? Do you feel it kind of easing?
It is
How's your
easing,
cup
yeah,
cut?
it's easing.
So now that we were able to get on top of our pain, that allowed us to get a more thorough in-depth assessment to identify what is the full extent of our injuries.
I'm going to try and get that boot off. Olivia, what we'll do is Gail, me and Lee will support your leg, because if we've got plenty of hands on it, it should reduce the movement, and see if we can salvage it without cutting it. If it's too unbearable, we'll cut it, but we'll try and avoid it, eh?
You keep going with that.
So you've got there.
That's the good stuff.
Okay, 1, 2, 3, there we go, well done, Olivia.
Is that right in the middle of your leg, that pain?
Right, if it's too sore, just tell us to stop. Yeah, we'll just cut it.
It's quite tight around the foot. It's not like a welly or that there's a bit of leeway, there's nothing.
Sorry, Olivia. Try and do.
Doing really well.
As gentle as we can with it, right?
No,
Yeah.
you on there?
Yeah. You okay?
Yeah.
Right, we'll just snip.
There's
Sorry,
the boot off,
darling.
right?
Do you want to see your
Box
foot?
A blanket or something for under
You want it?
R.I.P.
Do you want to
Where's
make it?
sore, Olivia? Is it your ankle or your leg?
Above my ankle, it's maybe 3/4 down.
It's like it's near the ankle, eh?
Is it sore there?
So your foot went to the right?
Further up.
That's like a posterior dislocation, isn't it? So a posterior dislocation is one of the most common ankle dislocations that you'll
So
get.
it went off.
When we managed to get our socks and our boot off, there was quite a bit of swelling, quite a bit of tenderness, and the ankle was almost pulled backwards and the bottom of the leg bone was pointing forwards. These sort of injuries you need to be quite mindful of to make sure that there's still plenty of blood circulation getting to the limb.
What we're going to do in a minute is we're going to pop a splint on your leg, all right? That'll keep it nice and still.
Go and see how you lifted your foot up. Go
If
and
you
do
can,
that again.
do that again.
It looks like it's out. It's disced, doesn't it? Let's try and straighten that, Toots. She's got good sensation the whole way. Can you try and straighten your leg out for me, Toots? You're almost there. Well done. So as paramedics, we're not trained to relocate dislocated joints. That's an advanced practice carried out by our critical care practitioners and the doctors in the A&E. But what we will do is we will sometimes try and just reposition a limb just so it's in an optimal position for us to be able to stabilise it for transportation.
The SORT team have to move Olivia to an ambulance, which is waiting at the other side of the field. It's a delicate job that requires a more rugged form of transport.
So the Wolverine is our all-terrain vehicle. It can access areas that a land ambulance couldn't and most of the SORT vehicles couldn't. It's got 4x4 capability, so we can retrieve patients from difficult access areas, whether it's across fields. It's a nippy wee vehicle, and it is the most versatile bit of kit I think we actually have, isn't it? It's our baby ambulance.
You all right?
Straight in. Right in, that's us.
Olivia will be transferred to an ambulance and taken to Edinburgh's Royal Infirmary.
We'll be as gentle as possible.
Right, so nobody else is abandoned, everybody's got a lift.
Right.
Still breathing. So reassessment, we've got breathing, so he's on oxygen, he's got 100 sats at the moment. He's tolerating that airway.
Ashley and Kira are treating a patient who has suffered a suspected drug overdose.
His pupils are still quite small.
Despite 2 doses of naloxone, the patient is unresponsive.
His pupils haven't changed at all. Normally by now you start to see a response from the Narcan. If patient has more opiate in their system than the naloxone we give, as soon as that naloxone wears out, they will become unconscious again. It will slow their breathing again. Small scratch.
With little improvement, Kira gives the patient yet another dose of naloxone. Ashley carries out another pain stimuli test to try and provoke a response from the patient.
It just moved his hands just slightly, but it's still not much. The fact that he's not responded, he didn't become conscious at all, his breathing didn't change. We needed to get him to hospital because there wasn't anything more that I could do. We couldn't find out what he'd taken, we couldn't provide any further treatment.
Right, you ready? Yeah.
The crew have a 20-mile journey to the nearest A&E department at Ninewells Hospital on the outskirts of Dundee.
You're trying to keep calm, drive safely and get them there as quickly as possible. You do feel the pressure, you definitely do, and you're aware that you have an extremely sick patient in the back.
The risk is that his numbers could change quite quickly and his condition could change, so we just need to monitor him quite closely, just so that if something does change, we don't miss it. It's too much of a risk that his breathing could drop off to a point that's dangerous for him. You're worried, is this patient going to get worse? Am I going to be able to manage it? Drugs can cause seizures. Is this patient going to have a fit? Are they going to stop breathing? There's just so many eventualities, and just trying to manage that can be quite a stressful job. Can you hear me? It can still feel like a lifetime sometimes when you've got a really sick patient in the back and you just want to be at hospital and you know you need to get them there. It can feel like the longest 20 minutes of your life. You're in an ambulance. We're taking you through to Ninewells Hospital. I think you've had a little bit too much for drugs this afternoon. I have a feeling he's not going to remember any of this journey. He's going to wake up in hospital and not even know how he got to Dundee or what's happened. We cover a lot of areas, and particularly in Perth and Dundee, that we will get a lot of drug overdoses, and it is quite prevalent. And you hear the stories on the radio about how Scotland has a high drug death rate, which is why they try and roll out things like naloxone for family members, for the police, so that these drug deaths can be avoided.
At A&E, the patient will be taken to resus, reserved for the highest priority cases.
It can be really upsetting to see, but you don't know their story, you don't know how they've got there.
These people are someone's son, they're someone's brother, they're someone's family. So it is hard.
The Scottish Ambulance Service receives over 1 million calls annually.
Ambulance service, is the patient breathing?
Call handler Chloe has been part of the team for 2 years.
And what's the address of the emergency, please?
It was actually back in school. I actually wanted to be a paramedic, so it started off there. So I seen this job advertised and I thought, what a great way to get my foot in the door. So I did that and I've actually fell in love with the job.
Thank you. Confirm the address, please. Are you okay? Caller, can you hear me?
The caller is shaking and struggling to speak.
Caller, can you hear me?
So I've tried to get some information and the caller stopped responding to me and it was just that breathing that I can hear. So at that point, I'm not sure what's going on.
Caller, can you hear me?
Anything could happen. Possible cardiac arrest, possible seizure, possibly choking, I don't know. But we've made the call the highest priority it could be.
Okay, I'm organising help for you now, okay? So just stay on the line. If you can hear me, we're going to get help to you, okay?
Your mind goes to worst case scenario. I have had patients on the phone previously that have passed away on the phone with me. And again, I just stayed on the line and yeah, just kept speaking to them.
Okay, caller, I don't know if you can hear me, but we've got an ambulance arranged for you. I'm going to stay on the line, okay? So don't hang up the phone. Stay on the line with me, okay?
It's been minutes since the patient's last response.
Caller, can you hear me? Right. Okay. What's your name? How are you feeling? Can you tell me what's happening?
I was quite worked up at the beginning of the call, not knowing what was going on. And I was just so relieved when she did come on to the call eventually and she was talking to me.
You're shaking. You think it was a seizure? Okay, right. We're going to get an ambulance to you as quickly as we can, okay? You just keep talking to me and telling me what's happening.
The patient is currently alone at home and sounding disorientated.
This is the ambulance service. When did you phone me? It was about 8 minutes ago. All right, you just try and stay nice and calm just now, nice and relaxed. We're gonna get someone there to check you over, okay? I know it's scary, but you're doing fantastic. You just stay nice and calm for me. Try and control your breathing.
She was really anxious and upset through the call, and quite rightly so. I mean, she didn't know what was going on.
And are you still shaking? Yeah, okay.
It's scary for someone who's possibly on their own, maybe having a seizure. It's just making sure that they know that we are doing everything we can on our end, and that they aren't alone.
You're doing really well. You just stay on the phone with me just now, okay? You've done really well. Are you warming up a little bit, or are you still quite cold? Perfect. Is that them there? Perfect. I'm going to leave you with that ambulance crew, okay? All right, you take care. Bye-bye.
Being a call handler, you don't get that closure that crews do out on the road. We don't have that. But yeah, there definitely are really tricky jobs and ones that will forever stick with me.
The Scottish Ambulance Service has to cover an area of more than 30,000 square miles. To reach the more remote parts of the country, they have air bases in Inverness, Aberdeen, and here in Glasgow. Stephen is the lead paramedic on today's shift.
I have just passed 20 years now with the ambulance service. It's a great job, I just love doing it. What's not to love? I've got an aircraft that flies me around Scotland. I've been in places in Scotland I would never ever go. Met some great patients, get some great stories from the patients. Take it mum's travelling as well. Dad is travelling.
A call has come in from a clinic in Campbelltown in Argyll, 130 miles away by road.
Okay, excellent. Right, thanks a lot. Bye-bye. It's an 8-year-old child who has had abdominal pain since last night, but now showing all the classic signs of it being an appendicitis.
Stephen, alongside pilots Grant and Richard, will transport the girl to the Children's Hospital in Glasgow for urgent treatment.
Let's go to Campbelltown. Right, we're going. So your appendix is a small pocket that sits on your large intestine. It's about the size of your pinky and kind of sits down, and the worry is that it becomes inflamed and infected. It can burst within your abdomen and take that infection right through your abdomen. Then it becomes a much more serious problem.
Today, the crew are travelling in the King Air, one of the Scottish Ambulance Service's fixed-wing aircraft.
The King Air, we have everything that's in a road ambulance for treating people. They need a medical escort. They need someone who can intervene if they do take unwell. See where the clouds are? Kind of down the bottom of the runway? That's Campbelltown. So that's where we're going.
Okay, that's all tested and on. Doors. Clear, secure, whatever.
Hello, Lorna. We're good. We're getting ready to go. Right, we will be about 15-20 minutes in the air.
Ground equipment. Clear left, clear right, and beacon and lights.
Although Campbelltown does have a road that brings you down to Glasgow, it's 2.5 hours. There'd be nothing worse than her halfway down the road where you're still an hour away from Glasgow and getting very, very unwell because the appendix is ruptured. We're heading out towards Northern Ireland, the Irish Sea. We'll get to Arran, we'll probably turn over Arran, and that brings us on a straight route into Campbelltown Airport.
Very good, it's a nice steep climb.
We are the quickest option for that patient to bring her down and get her seen and get this problem sorted as quick as they can. You know, there has been instances of fatalities because of ruptured appendix. So that's what we're really trying to avoid.
It's taken the team 20 minutes to reach the runway at Campbelltown.
Okay.
There it is.
Everything's off. Okay.
Hello.
So this is BT. The last 3 days she's had complaining of a wee bit of right-sided pain just in the lower abdo. Last night they went to the cinema, and as they were coming out headed for home, she's got quite severe in the centre of her abdo, and they went into A&E with that. This morning pain was worse, and it's gone over onto the right-hand side again.
Accompanying Beattie is her dad, Jess.
Is Beattie normally that colour?
She is normally pale, and you do normally see her veins, they present like that.
Yeah.
But she is much kind of paler and maybe even a bit kind of blue looking.
Yeah.
Compared to what she would...
Normal,
normal paleness, yes.
Pain score, she's saying 10.
10.
It was, and then was given paracetamol at 10 o'clock this morning. It's gone back down to a 2.
Excellent, that's good.
She said she's feeling a wee bit nauseous as well, so I've given her the bowl.
You feeling a bit sick? Well, there's a simple rule on the airplane, Beattie. If you're sick and you make a mess, you need to clean it up.
We'll ask your dad to clean it up.
It's always dad.
Right, so what we're going to do then is we're going to get you onto the plane. Does that sound okay?
The doctors in Campbelltown had given her some pain relief, some anti-sickness medication as well, and she was probably as comfortable as she was going to be. We weren't going to sort of add anything to that. What she needs as a surgeon looking at her. So what we're adding to the mix is probably speed, is to get her to the surgeon.
Right, you just take your time, okay?
"90 miles away, paramedic Andrea and technician Kirsty have received a call about an elderly patient.
So, a male having a stroke can't get up, not speaking properly.
I was like on 92.
999 activated.
Got a job? I think he's woke up with it.
Maybe. Unable to tell the time of when these symptoms have started.
What a shame, poor wee man.
Obviously, the strokes can be life-threatening. They present with so many symptoms. The 4.5-hour window is really important to spot these symptoms.
You get symptoms of a stroke, you really need to call straight away, because the sooner you're treated, the better the outcome's going to be and the less, hopefully, long-lasting damage on you.
I wonder if it's maybe been a carer or somebody that's came in and noticed that his speech is slurred.
What a shame.
Oh, so the front door's there? Hiya. Is it for Tom?
It is.
Yeah.
So what's been going on today, Tom? You woke up?
At 2 o'clock, and I couldn't get back to sleep.
Okay.
And I've been to the toilet.
But
it was a struggle. I had to go by hand.
Like kind of furniture walking?
Yeah.
Right, okay. Yeah. And do you normally furniture walk, or are you quite good on your feet?
I'm going to do a few checks while Kirsty chats to you, all right?
So you just feel like, are you feeling dizzy, or?
Yeah.
And just a bit off balance?
Yeah, I think
Tom's wife, Catherine, made the 999 call.
And how do you find Tom this morning?
He's up and about normally.
Right, okay, so it's just really like your balance and the dizziness that you're quite concerned about?
But it's about slightly down.
And walking is difficult.
And it's not normally?
Not normally.
And that's just been about since 2 o'clock this morning?
Well, I was in bed most of the time.
Yep.
All the time.
Right.
Didn't sleep.
But didn't sleep. And what time did you get up to go to the toilet at?
I don't know.
Will you pop this in your ear, Tom? Is that all right?
Go ahead.
Because he'd woke up at 2, I think, to go to the bathroom, and that's when he noticed he was kind of off balance and he was dizzy. And then we also got there at like 9. He'd missed the kind of window of treatment. His blood pressure is high, isn't it?
Do you normally have high blood pressure, Tom?
No.
Maybe us turning up at this time in the morning is enough to put your blood pressure up. His blood pressure was through the roof, and obviously things like high blood pressure, high cholesterol, all these untreated are contribute factors to a stroke.
Are you feeling like a numbness or a weakness, or?
Yeah.
Okay.
Kirsty carries out a fast test on Tom, which can quickly identify the 3 common signs of a stroke.
Right, and keep your hands there for me. I'm going to let go.
Facial dropping, arm weakness, and speech difficulties.
If you're fast positive, it means that you have you're likely to have had a stroke or some kind of cerebral event.
Push your leg up, that's it. Yep, and down. And this one? Okay, doke. And can you repeat a phrase, the early bird catches the worm?
The early bird catches the worm.
Can you give me a big smile?
Yeah, best I can do.
He had a droop to the mouth and a weakness down one side. That's another symptom of a stroke. Okay, and are you in any pain anywhere?
None at all.
No chest pain, no headaches?
No headache, no.
Good.
Just pop some stickers on, have a wee look at your heart and things. Is that all right?
Yeah. Go ahead.
I'll just
Any heart problems? Not had any heart attacks? No strokes in the past?
Nothing.
Nothing?
No.
What's the secret?
Space out more, if we can afford it.
Not in this current climate.
He was doing absolutely great for his age. He was.
I don't think he took any medication. He didn't look 92.
How long you've lived here?
Oh, in this house? 1966.
Yous manage okay at home and things? Any carers or that come in
He's
to
my
help?
carer.
He's your carer.
Is he?
I've got dreadful carpal tunnel.
Okay.
And legs are bad.
Yep.
Independent.
You're doing great.
Is it attached?
It's still beating.
So, see, considering obviously you've experienced these symptoms, I'm going to recommend a trip up to the hospital, Tom.
St.
Just
John's,
so,
okay.
just up to St. John's, just so obviously the doctors can kind of do their assessment.
Can drive.
You'll not be driving.
We'll take you.
You'll take it?
Yeah, we'll take
We'll
you
give you a
up.
lift for free. The first one's free.
Second one's a £5. A wee step back, there you go.
And that's it. You push your bum right back.
Push your bum back.
Andrea and Kirsty will transport Tom to the local hospital. There, a team of specialists will assess whether the 92-year-old has had a stroke and what treatment he needs to aid his recovery.
There we go. How's that?
Good.
Right, are you warm enough or do you want a blanket?
In Campbelltown, Stephen and the King Air crew are getting ready to fly back to Glasgow with 8-year-old Beattie, who has suspected appendicitis.
Right, we're leaving. We will be about 20 minutes back.
Is Coo okay?
I probably think we'll need an amber call for this wee lady.
Dad, what's an amber call?
Don't know.
It's what we will use for the ambulance. We can tell if people are, like, not so sick, or a big bit sick, or really sick. So the amber one's in the middle, because you're quite sick and we need you to be looked at by a doctor. Is that okay?
Yeah.
Good.
Children are great judges of character, so you need to tell them what you're doing, tell them who you are, and try and build a bit of rapport with them.
Are you still sore? A little. And where is it? Is it on the right side or is it in the middle?
Like here.
Up there? Oh, right.
Sure, is that side BT? Because up to now it's been down this side,
Yeah.
isn't it?
That's the thing about appendix. Sometimes
It
when it
migrates.
moves on, it migrates out at the other side.
Appendicitis can be a serious problem, and he probably knows that himself. You're wanting to reassure him that at that particular time you're the best person to look after his daughter. It's one less stress in his life that he needs to worry about, that he's got trust and faith in what you can do for his daughter.
The monitoring I've got on, that's as much as I'm going to do while we're in flight. But if she gets on well, there's other bits and pieces I will need to do.
Sure.
I will tell you what I'm doing, but my hands will be going at the same time. Is that okay? Don't worry. All right. The biggest thing you should worry about is throwing up on this aircraft, okay? That's fine.
I feel quite sick and I don't.
Yeah, but that's probably just the motion of the plane, darling.
The past few years have been particularly difficult for Jess and his family.
You know, sometimes in life you think that you've cracked life, and you know, couldn't believe it, and then just one Tuesday evening, we all watched a film together, and you know, it's one of those cases where sometimes life can change in a breath. We watched the film, and my wife said that she would go up and take the children to bed, and then within 3 or 4 minutes I heard a commotion from upstairs, and I thought he was mucking about with the children because we were always playing around, and then I heard my eldest daughter Gwynnie. I heard her say, "Oh, Mummy, get up, you're frightening us." And then I ran up the stairs and Vicky had collapsed, and we called the ambulance, and I was doing CPR, and I mean, now I realise that Vicky had passed.
He's just lost his wife. He's still grieving for her. And now he's got a sick kid. You know, having a family of your own, you can't help but sort of put yourself in that position. There was a lot going on for him, and I think he was still processing a lot of grief while trying to look after the family.
You know, you have the normal highs and lows and the challenges in life and that, but then sometimes you can have things which they kind of really exceed that.
Since her mother's death, Beattie's found comfort in an ever-present companion.
Koo is like it's what we call a magical animal. So we have, you know, and since Mum died and everything, Koo goes everywhere with Beattie.
You know what the next thing's going to be when she gets a bit older, don't you?
It could be a horse.
No, you're going to have to buy her a Highland cow.
I'm a bit scared of cows, so, you know, it's a bit, but this one is fine.
Beattie, we're nearly in Glasgow.
It's fast, this plane, isn't it? You're going to feel us go boop, boop in a minute, and we're going to land, aren't we?
Fortunately, Beattie's condition hasn't worsened on the journey, but she's still very poorly and in need of specialist care.
That's okay.
Are you still feeling sick? Yeah. So if you sit tight for a few minutes, I'm going to run away and make sure there's somebody there to take Beattie onwards. Right, Beattie, you come. You want me to hold Koo?
After we land, the ambulance crew will then take over the care on the transfer over to the Children's Hospital in Glasgow. So they will go straight to the ward, and then the children's doctors will take over care.
This blanket's better than your blanket.
Is it?
This
Is that warmer, maybe?
Well, it is because...
Special lane one, is it?
No, it's a Campbelltown one.
Who are you? Who's this you've got with you?
That's Koo.
Koo?
This is that. You're welcome. Listen, all the best. And I might see you on the way back. Who knows?
Probably one of the best things I've ever done is becoming a paramedic. I've learned an awful lot, but I think I've learned mostly that the people in the Highlands and the Highlands of Scotland are very resilient. You know, they put up with a lot and they got on with a lot. Yeah, it's opened my eyes to life.
Paramedic Andrea and technician Kirsty are on their way back to base.
Might stop off, get a wee hot chocolate or something. Can you go a shift without hot chocolate or that?
Absolutely not.
Or your coffee?
I love coffee. So I'm always like, we'll go to Starbucks. So sometimes she'll push the boat out and she will get a wee hot chocolate.
Yes, but I love my cups of tea. I've got to have 2 cups of tea before I start my shift.
And today, Kirsty has extra reason to treat herself.
Get a birthday coffee.
Get a wee Colin Caterpillar birthday cake. It's just another day when you're older, isn't it?
.999 mode activated. Got a job? A text message. So, we are going to a red call for a 74-year-old male, secondary progressive MS that lives independently with wife, support for family but no external carers.
The patient, David, has multiple sclerosis, a chronic degenerative disease. David's wife is a former nurse, providing the ambulance crew with his readings.
Oh, SAT's now 45%, blood pressure 130 over 54, heart rate 59, now paler, colder and more confused. SAT's at 45. 45%. So obviously that's the amount of oxygen in the blood. Everybody should be kind of over 94%.
David's drop in blood oxygen could point to a life-threatening problem.
Has this been an upgraded urgent aim?
En route, it was decided that that was then going to be upgraded to a higher response, because obviously going with what had been said on this job, this patient needed to be treated quickly.
Hi David, how are you? How are you doing?
This morning when he got up, didn't eat his breakfast, I was quite confused.
Okay, look. And is that just today that the confusion?
Aye, oh aye, he's usually really lucid.
Okay, look. And apart from the MS, any others?
He's got ischemic heart disease, he's had a bypass.
Look, and he's
had quite a few
sepsis.
stents.
He was breathing quite fast. He was kind of a wee bit confused, and obviously again the family were saying that he was confused compared to normal.
Right. David, I'm just going to pop you on some oxygen, all right? It would just kind of help.
But it's called kind of basically ischemia. They've not got enough oxygen, so you're becoming confused.
Right, David, bit of oxygen, all right?
Obviously, we treated him straight away with kind of high flow oxygen. So he was kind of blue around his fingers, which would also indicate that his oxygen levels are quite low. David, I'm going to have a little listen to your chest, is that all right?
Yeah.
Yeah. You not had a cough or anything like that?
No.
No. You got any pain anywhere?
No.
And any like new signs of infection or that? Any like coughs,
I've just
colds?
tested his urine and Catherine.
Concerned by her husband's symptoms, Doreen has tested his urine for signs of an infection.
Did he get recurrent UTIs?
He's had 3 over the past 2 years, I would say.
So urine infections can be really serious, and especially in like elderly people, it can really change like their whole personality. They become so confused, disorientated, and obviously left untreated, they can develop into sepsis. David, so I think from what Doreen's saying, it sounds like it's more like a urine infection like you've had before, but your oxygen levels are quite low and your temperature's high, your breathing rate's up a wee bit. And obviously our concern would be is that you've had sepsis and things before and we don't want it to lead to that. So if it's all right with you, we'll pop a wee drip in your arm, we'll give you some fluids and we'll need to take you up to the hospital.
So with sepsis, it's like an infection on the body, and it's the body's kind of own immune system kind of fighting against itself as well, and it kind of starts attacking like the organs in the body. So it can present with like low oxygen levels, low blood pressure, high or low temperature. Obviously if it's left untreated, can be fatal. So it's really important, kind of any signs needs to be nipped in the bud and treated as quick as.
So have you got any mobility at all, David, now from your MS? No. Oh, perfect. I'm just trying to straighten that elbow for me if you can. No.
Sepsis kills thousands of people across Scotland each year. David will have to be taken to hospital to begin a course of antibiotics.
I think probably his urine was quite concentrated in the urine bag, so he's probably not been drinking enough fluids. Sharp scratch, David. But obviously, we were just needing to get kind of fluids running and he was feeling a bit sick, so we gave him a little anti-sickness. Right, we'll just let these wee fluids run. We'll get you sat round a wee bit, all right, my darling? You sit up for us. Ready? 1, 2. You come. He's obviously got like a life kind of limiting condition, multiple sclerosis. You're roasting, David. It's quite a sad disorder though, because obviously like you find that normally neurologically they're absolutely fine and they're just more their body's kind of not able to kind of function as normal. Ready, David? 1, 2, 3.
So obviously in this case, he wasn't able to mobilise independently. We tilt back. So it's all that we kind of need to think about that, how we're going to transfer these patients.
You can't say bring your arms up and hold them in like you would, you know, you've just got to be a bit more cautious. 1, 2, 3. That's it.
There we go. Right, we'll get that board out.
There we go. How are you feeling? A bit sick.
Are you good to go?
That's fine, Kirsty. So once we obviously got into the ambulance, we determine obviously how sick the patient is, and we can phone ahead to the hospital so we can give them a little standby call. Hiya Kim, this is just to pass a wee standby wee doll for a 73-year-old male. Pre-Euro sepsis, he does have a catheter and ET is about 5 minutes over. In David's case, Because we were querying sepsis and we weren't sure obviously the source, he would need antibiotics quite quickly because the sooner obviously it starts to get treated, the less kind of lasting effects and things he's going to have. You all right? You'll not be long, all right?
Because of his symptoms, David will be seen straight away on his arrival at hospital. Ambulance crew Kira and Ashley have returned to Perth city centre for another call.
4525. Good evening, guys. Please fire call reports of 2 persons in the water. No other details yet, but we're going to contact them, so they'll probably be on the way to see.
Police and fire and rescue are also attending the incident on the River Tay.
So all we know so far is that there's 2 people in the river. We don't know their ages and we don't know the status of them and what's going on any more than that. It's not uncommon to get calls for people in the river, and unfortunately they have had serious outcomes. So there is always that concern that when we get these calls, we have to take them really seriously because those people could drown, they could become hypothermic, they could be injured. We'll just meet at Bridge End. We've got a rendezvous point where we will meet with the fire brigade and they'll kind of direct us as to where we need to go.
For an incident like that where there's 2 individuals in distress in the water, we would expect a multi-agency response.
It allows all aspects of safety for those patients, the safety for us, and being able to get patients out of the water and to a safe place. So the police are down there. I don't know where
You're expecting sort of this potentially major incident, and your adrenaline's going, your heart's racing.
Stop, stop, stop! We're not really sure where to go, so we can see 2 police cars on scene. One is in a car park just before the bridge on the Dundee side and one is just after. Have they got any more information as to the best access point?
Haven't given any details on that.
We just want to get to the patients. The sooner we get to them, the better.
Thank you.
I don't really know what we need at the moment because we don't really know anything about the patient's conditions. We might be able to see from here. I don't think you can get down from this side. Can't see anyone. Still really difficult to get down to them. We were walking around, we were walking over the bridge. We could see that the police were down there. Is there any chance you could message the police and just see if we could find up a better location?
Yes, we'll contact police right now.
Thank you. Kira, I'm going to see what I can find out from this side, just in case I need to move.
See the 455.
So we've been able to make visual sights of the 2 occupants of a boat. They're on the bank and they're no longer in the water.
That's obviously.
Kira and Ashley finally make it to the patients, now out of the water and in the care of the police.
It's a sense of relief when we turn up and we see that the patients are out of the water.
They were conscious, they were able to speak to us, so we can breathe, take a step back and not kind of go rushing in.
Okay, we'll come, mate. I'll come.
Just come and have a seat here for a sec.
Yeah, all right.
Have you been in the water at all?
Yeah, no.
You're not wet though, are you?
No,
just
no.
a little bit.
Just over there.
But you're not cold or wet? No.
Come on.
And you haven't hurt yourself?
No. I almost swam across, that's on back.
You swam across?
Yeah.
You look fairly dry for someone who swam across the river.
I took my clothes off.
Oh, did you? Okay.
Well, here, it's stupid swimming in your clothes.
Luckily, they were just having a fun afternoon in the river. But there is a very serious side to it, like it could have been a very different outcome.
Absolutely.
And is this your friend who was with you? And are you okay then? You haven't hurt yourself?
No, I'm brand new.
Yeah. Have you been drinking today?
I have been, yeah.
Yeah. How much have you had to drink?
Maybe a bottle of wine, yeah.
Yeah, okay.
All this fuss for nothing, eh?
Yeah.
Exactly, darling, yeah.
Yeah. We have a duty of care to these patients to ensure that they are safe and uninjured and they're just laughing and having a good time and think that this is all a bit of a joke, but you're actually trying to get information, there's a serious side of it that you're trying to make sure that they're okay.
All right. Thank you very much.
No worries.
Thank you very much. Right, bye-bye.
You're welcome. Take care. Be careful in the river and around water, okay?
I'll not do it again.
Yeah.
Okay.
Especially when you've been drinking. Okay. All right. Well, that sounded like it was going to be a lot more dramatic than what it ended up being, in a good way.
Yes, it was the best outcome.
Yeah, and I think they were probably just having far too good of a time and got disturbed by people concerned for them on the river.
A bit frustrating, but, you know, you'd rather that.
You're just glad that they're okay.
Yeah. Oh, look.
Oh, there they are.
There they are.
Still having a good time.
Oh, they look really happy.
I think I'm really happy that they're no longer on the river.
So I remember it was the weekend. We were in the bedroom and she said to me that she had abdominal pain. And then funnily enough, Big Sister said, oh, she's got appendicitis. She's got appendicitis. I said, no, she won't have appendicitis.
You were proved wrong later.
I was proved well wrong, yeah. How was you feeling when you was in the air, BT, on the aeroplane?
Honestly, I don't really remember because I was barely awake during the plane. I was mostly asleep.
It was kind of surreal in a way because, 3 years ago, Vicky, my wife, she collapsed at home with a cardiac arrest and she was flown by air ambulance to Glasgow. So there's that kind of wondering, it's kind of, oh no, not again. Vicky, how are you doing since the operation, would you say?
Very, very good. It took at least 3 weeks to get a little bit of my flexibility back.
She was so resilient because that's the kind of little person she is.